Ever felt like your knees are on strike, refusing to cooperate when you need them the most? Well, you're not alone. Knee pain is a common complaint. It's that uninvited guest that can put a damper on your daily activities, leaving you frustrated and seeking relief. But what if we told you that understanding the root cause can be the first step towards reclaiming your mobility? Enter the world of arthritis, a common culprit behind that pesky knee pain. Now, before you start picturing yourself in a rocking chair, let's break it down. Arthritis is not just one condition, but a group of them, with 3 types primarily responsible for knee pain: osteoarthritis, rheumatoid arthritis, and gout. Each has its own unique characteristics and symptoms, but all can make your knees feel like they've joined a rebellion against you. Before we start blaming our knees, let's understand the culprit behind this discomfort: arthritis. Imagine your knee as a well-oiled machine. Now what happens when that oil starts to dry up? Welcome to the world of osteoarthritis. Let's picture your knee joint as a beautifully crafted, smooth, gliding door. The cartilage in your knee is the magic oil that keeps this door moving effortlessly. But in osteoarthritis, or OA for short, that slick, protective cartilage starts to wear down over time. It's as if the door becomes rusty, creaky, and harder to move. This wear and tear can lead to pain, stiffness, and sometimes even a grinding sensation, just like an old door hinge that needs some good old WD-40. Now, who's most likely to get an uninvited visit from osteoarthritis? Well, it usually targets people over the age of 50, but it can also make an appearance in those who put a lot of stress on their knees. You know who you are: the marathon runners, the weightlifters, or even those carrying a little extra weight. But wait, there's more. If you're thinking, well, I'm not 50 and I don't stress my knees, so I'm safe, don't be too sure. Osteoarthritis doesn't discriminate. It can creep up on anyone, anytime, and once it's there, it's there. There's no cure. But the symptoms can be managed. Picture this. You wake up one morning, and your knees feel stiff. You try to shake it off, but as the day goes on, the stiffness persists. You might even start to feel a dull, aching pain. Then, the grand finale, a grinding sensation every time you move your knee. If this sounds like your daily routine, it might be time to chat with your doctor about osteoarthritis. So, if your knees feel like rusty doors, it might be osteoarthritis knocking, but remember, knowledge is power. Understanding what's happening inside your body is the first step toward managing it. In our next scene, we'll decode another common culprit of knee pain: rheumatoid arthritis. But for now, let's bid adieu to our friend osteoarthritis. Don't worry though, we'll be seeing each other again. After all, osteoarthritis is like that persistent door-to-door salesman. It doesn't give up easily. Stay tuned. Now, what if I told you sometimes our bodies get confused and take up arms against our own joints? Sounds like a sci-fi plot, but it's just rheumatoid arthritis. Imagine your body's immune system as a vigilant security guard, always on the lookout for harmful invaders. But in rheumatoid arthritis, or RA, the security guard gets a bit mixed up. Instead of protecting your joints, it starts attacking them, like a spy infiltrating its own agency. This is why we call RA an autoimmune disease. Unlike osteoarthritis, which is like a door hinge wearing down over time, rheumatoid arthritis is more like a friendly fire situation. The lining of your joints, which should be all comfy and cozy, gets inflamed and swollen. It's as if your joints are throwing a party. But instead of fun and games, there's pain and stiffness. And here's the real kicker. While osteoarthritis is a bit picky, usually affecting people over 50 or those with a lot of knee stress, rheumatoid arthritis is not that choosy. It can strike any joint at any age. So, if you're experiencing joint pain, don't assume it's just an old age thing. Now, let's talk symptoms. With rheumatoid arthritis, you might feel pain, swelling, and a warmth in the affected joint. You might also experience stiffness, especially in the morning. Imagine waking up, ready to seize the day, but your joints seem to have hit the snooze button. That's what RA feels like. But it's not all doom and gloom. If you're experiencing these symptoms, it's important to talk to a healthcare provider. They can help you navigate the stormy seas of rheumatoid arthritis and guide you towards effective treatments. And remember, knowledge is power. Understanding the difference between rheumatoid arthritis and osteoarthritis can help you communicate better with your doctor and make informed decisions about your health. So, if your joints feel like they're under siege, rheumatoid arthritis could be the invader. Ever had a midnight knee rebellion with pain so intense it feels like your knee is on fire? Might be gout crashing your peaceful night. Now, gout is a bit of a rogue. It's not your typical arthritis. It's caused by the buildup of uric acid crystals in your joints. Think of it like a crystal party in your knee, and not the fun kind. This crystal buildup can cause sudden, severe pain, redness, and swelling, often in the middle of the night. It's like your knee decided to have a rave without your permission. Gout often targets the big toe, but it can also affect other joints like your knee. Interestingly, gout is more common in men than women, and certain foods and drinks, especially those high in purines like seafood, red wine, and meat, can trigger a gout attack. So, if your knees are having fiery night parties without your permission, gout might be the uninvited guest. With all these arthritis types gate-crashing our lives, what can we do to show them the door? Let's explore some options. First off, over-the-counter pain relievers like ibuprofen can help manage the pain. For more severe cases, prescription medications may be recommended by your healthcare provider. Physical therapy is another route, aimed at strengthening muscles and improving joint mobility. And in the case of osteoarthritis, managing your weight can take some pressure off those knees. But what about some alternative approaches? You could consider acupuncture, where thin needles are used to stimulate specific points in the body. Yoga or Tai Chi might also be worth exploring to improve flexibility and reduce pain. And for those dealing with osteoarthritis, weight loss supplements may lend a helping hand. Remember, knee pain is a battle we can win. Understand your enemy, choose your weapons wisely, and reclaim your life. Until next time, stay active and keep those knees happy.